In terms of the prevention of acne, there are a number of things that people can do. The first thing is things that people can do at home. And those things would be to avoid the use of products that are causing the acne. So for example, my adult patients, I tell them do not use any products that are lotion or cream based. No lotions, no creams, and also no oils. So things that they should look for is gel consistencies, and if they do need to use a sunblock, for example, a clear sunblock spray. In addition, they can use water-based serums, but they should avoid anything that's a lotion or a cream. With respect to makeup, the same thing applies. No liquid foundations, but they can use powder formulations. So that's what they can do at home to prevent it. In terms of what they can look for at a drugstore to get, I'm a big fan of a benzoyl peroxide that is a gel moisturizer base. That way, they won't get too dry. The proper way to apply benzoyl peroxide at home is to put the size of a pea on your baby finger and then dab it on your forehead, your nose, your chin, and your cheeks. What we call a field treatment. I am not a big fan of spot treatments for acne, because if you use a spot treatment for acne, you'll treat the spot, but you won't prevent a new spot from coming. So you want to use a very small amount all over as a preventive measure rather than using a lot in one spot. Using a lot in one spot will just cause dryness and irritation. So that's what people can do at home. In terms of what they can do when they see me, I see them, I do an assessment. So I do a history, I do a physical examination, and then we discuss a management plan. And that management plan will include topicals, as well as looking at what they can do for treatments. In terms of topicals, once again, I'm a fan of a benzoyl peroxide and also a vitamin A. Now the nice thing, especially for women, is that the vitamin A is good for their acne, but it's also very good for wrinkles. So it does two things. So that's a great thing for people to use. I usually have them apply the vitamin A at nighttime, and I like a vitamin A in a liquid formulation. That way you can titrate it. So if you're drier in the winter, you use less, and then in the summertime, you can use a little bit more. In terms of other treatments, there are many treatments available for acne, so the important thing for adults to know is that if you have adult acne, you're not stuck with it. There are multiple treatment options. In terms of what you can do in the clinic, I discuss the treatment of peels with them, in addition to something called a blue light, which is a specific wavelength of light that targets the sebaceous gland or the oil gland. In addition, there's another treatment called photodynamic therapy. And that therapy consists of a drug called Levolin. The Levolin is applied to the skin, and there's an incubation period of usually 1 hour to an hour and a half. After that time, we use a light. The light activates the drug, and the idea is that the drug is sitting in the pilosebaceous unit or the oil gland unit. And when the drug activates that unit, that drug, what happens is you get a decrease in oil production, and that helps with acne. So those are two very practical things that we can do in the clinic, and also practical things that we can do at home.